So let's talk about best weight. There are many, when people come and they tell us, I want to be that, or my weight should be this, I want to have a goal weight, or my ideal weight should be this. So there are different words that are being used, or there's different expectations. My lowest weight was this, my highest weight is this. But when it comes to realistic expectations, I think it's good to have some realistic expectations, because even though I will keep repeating that our primary focus is not on weight loss, and this is true, our primary focus is not on the number, but one can have a realistic expectations, not unrealistic. So as per the research, the realistic expectations, if you do all these three streams of what we offer, psychotherapy, medical therapy, and medical nutritional therapy, one can expect to have a reasonable weight loss, and that what we call as the best weight. So best weight is not a number on the scale that you have made up your mind, or a goal weight, or a pre-wedding weight, or a pre-pregnancy weight, or your expected weight. But best weight is a weight that you can easily maintain. If somebody is focusing on 160 and you can never maintain 160 ever, and you really have to work hard, maybe that's not the best weight. Maybe 165 is your best weight, but which you can easily sustain. So one of the thing of best weight is a weight that you can easily sustain, maintain, and get the maximum health and functional benefits, plus you keep enjoying your life. That's what it is. You're not sweating yourself, or you're not ignoring or skipping or restricting most of the things because you just want to maintain your life. So best weight is not a number on a scale. It is easily maintained or sustainable weight. You get the maximum health and functional benefits, along you're able to enjoy your life. This is the best weight. So best weight is the weight where you're not fighting. You're not waging war against yourself. You're not criticizing yourself. You're still happy about it. Plus you're getting the maximum health benefit. So what I want you to understand, so best weight usually, as per the research, is anywhere from 5 to 15% over 4 to 6 months of total body weight loss. But I want you to see this graph. This is the most important. So most of the people come and they want, what, I want to be at this 140, 150, and maybe they're 230. So what they're hoping for this target weight loss, or ideal weight loss, or goal weight loss. So they want to be here in this line. So they start the weight loss journey keeping their mind here at this weight here. But what happens, your body will do certain, we know that the body, whatever the efforts you will do, body will lose weight anywhere from 5 to 15%, and after that the body will come to a plateau. We know that. That's why the maximum efforts is done at 6 months. After 6 months is usually weight maintenance. So 5 to 15% of the total body weight loss is usually achieved by a genuine efforts. So this person who came to a weight loss journey, start losing weight, and he did lost 5, 10, whatever the body can do. And he comes here, and after 6 months, he ended up in a plateau here. And then he plateau for next 3 to 4 months. But see what is happening. Even though he ended up in a plateau, but he lost some weight, look at the health benefits that he's getting. Now, even he's plateauing at 3rd, 4th, 5th month, what is happening to the health benefit? It's still rising. Still he's finding improvement in his quality of life, functionality of life. Why? Because he's able to sustain that weight. But what is happening to this person? Because he has put his mind that my weight loss should be somewhere here, he is not able to appreciate the functional and the health improvement that because he's just what? He's focused on number. What he's saying, that this is where I'm landed, but this is where I want. And this wanting is not giving him the feeling of gratitude. So what I want you to start thinking about, that yes, best weight can be achieved very easily, where you will get the maximum functionality, health outcome, you're able to maintain, you're able to enjoy your life. but it might not be the goal or the ideal weight. So don't think about the numbers. You will still get the maximum benefit out. So best weight is the weight that you're able to maintain easily. It gives you maximum health and functional benefits, and everyone's best weight is different. And what is the best weight is usually 5 to 15% of total body weight loss over 4 to 6 months. And we will know, is it 6 months for you? It is your hypothalamus that's going to tell us, because after 4 months, for some people they're plateaued. For some people, 6 months they're plateaued. We don't know. So what I usually tell to my patients, if you are on a weight loss journey and you have done pretty reasonable weight loss up to 5-7% and you're plateaued for 4 weeks, 6 weeks, then I usually say, you're plateaued now. Now let's think about weight maintenance. And we think about weight maintenance for another 3-6 months, because remember, your set point is 3 to 4 months behind. Your hypothalamus thinks you're still at 230 and you have lost to 200, but your hypothalamus still thinks what? You're still at 230. Still he's going to defend at 230. He's 3 months behind your weight scale. We need to work hard to bring him to 200 pounds so he thinks my weight is 200 and start defending that 200 weight. I want you to take 2 key messages and I want you to answer them. What is a success of any weight management program? What is a success here? What is a success? What do you think? Success of any weight management is weight maintenance. Now, second thing, what should we all be working towards? Best weight. We should all be working towards that. So best weight is a weight that can be easily maintained. You'll get the maximum health and functional improvement. You keep on enjoying your life with your friends, family, work. And then usually what is the best weight? Anywhere from 5 to 15% over 4 to 6 months. So the maximum benefits that we can get is all of these. So we'll get medical benefits, we get personal benefits. So it's been proven with 5 to 10% of weight loss, there's a reduction in blood pressure, improvement in cholesterol level, reduction into diabetes, and even if you're pre-diabetic or at risk, your chances of getting into pre-diabetes or diabetes is low. Improvement in COPD, asthma, osteoarthritis. Then, of course, there are some psychological benefits. So more energy, feeling better, feel healthier, able to move more comfortably and easily. Just a quick one, because I'm a chronic pain physician. So in normal population, most of the people who suffers from normal weight, they would have back pain, only 3%. But as your weight gets more and more and more, there's a pressure on the spine, and then you can get back pain, knee pain. It's been proven fact that an extra weight puts 4 pounds more pressure on your knees. That's why even 2 pounds weight loss would make your knee feel that they have lost 16 pounds. So 1 pound is equals to 4 pounds. So it's a proven fact. So one of your homework is to calculate your best weight, 5 to 15%. So I want to calculate both range, 5% as well as 15%. And we have given you a simple calculation how you can calculate it. Just to recap, this is how a 5 pounds of fat looks like. Right? So when we lose 5 pounds. Now, if you do a simple math, and that's why our body is not a car, because a simple math can actually tell you that if you're doing a calorie deficit of 500 every day, so when I put you on a calorie restricted diet and I say, we're doing a calorie restriction of 500 every day. So it's always a cumulative deficiency that gives a pound drop. So every day, if you are 5 pounds less, so 500, 500, 500, 500, in end of 1 week, 7 days, you would be 3,500 less of a calorie, and 3,500 less of a calorie will means 1 pound loss. Technically, I'm doing the math here, but you might not see that 1 pound loss on a scale. Why? Because our body is not a car. Even though you're doing the math, putting the less fuel in and you're burning more fuel in, and your gauge is telling you this. But our body is not a car. We do not go by the math or the formula. This is why, even though you are doing everything right, you are giving a body a cumulative deficit of 500 each day. By 7 day, you have calculated 3,500 less. I should be 1 pound less on my scale, but this does not happen. Why? Neurobiology, the hormones. Because the car doesn't have these good and bad hormones, our body has. So that's why. So please don't feel bad about it. There is a math behind it, but it does not work. Okay? So let's focus on best weight number over months. Let's be realistic, and easily you can calculate a number today, and we'll work towards that. Just a little caveat here, that you might see some days that there's a fluctuation of weight. So you have weigh yourself, you're 163, the next day 164, the other day you're... So fluctuation is normal. Our body is not a car. Our body is a human body full of water, poop, hormones. So this can happen. So we usually say in our weight world, anywhere of 3 to 5 pounds up and down are negligible. I don't sweat even at 5 pounds. Why? You haven't emptied your tank both ways. So constipation, pee, clothing, hydration. Some research even say up to 10 pounds is negligible, but I usually, for my patients, I don't give 10 pounds. I usually say 5 pounds. So for anyone, I tell my patient, alarm is 5 pounds. So whatever you have achieved your best weight at and you're able to maintain, if you're 5 pounds up, that should ring an alarm. And you should do something about it. If it's within 5 pound range, we are good. So even if you have lost weight last month and you're at 163 and you are 164, 165 next follow-up, don't sweat yourself. 5 pound range, it's very reasonable. Okay, so I'm going to stop here.